Hi, my name is Danielle Weglars, and I am a nurse in the lung transplant department at Michigan Medicine, and I am also a transplant coordinator. We are going to talk about how to prepare for your call for transplant and what to expect when you're admitted to the hospital. Once you're listed for transplant, you could be contacted at any time by a transplant coordinator instructing you to come to the hospital for your lung transplant surgery. Calls can come 24/7, and often patients are called in the middle of the night, on weekends, and holidays. It is impossible to predict when you will receive your call, and often patients are instructed to get on the road within 30 minutes of the coordinator contacting them, so it is important to be prepared. You should plan ahead. Both you and your support person will be focused on transplant and recovery while you are in the hospital. You will need someone to take care of your children and pets, and also your home and financials. You should let your social worker and financial coordinator know if you anticipate any loss of income during your recovery. We want to know about this ahead of time so we can provide you resources. You should also arrange for transportation. If you do not have a driver that lives in your home, who will be available to drive you to the hospital when your coordinator calls you in for your surgery? You will not have time to arrange these things when you are called by the coordinator, so it is important to arrange these things ahead of time. We encourage our patients to prepare a go bag when they are listed for transplant. The go bag should be placed by the front door or in the trunk of the car so that you are always ready to go for transplant. Some things you might want to include in your go bag are going to be pajama pants or sweatpants so that you can wear them while you're walking in the hallways after your surgery. You should also have shoes that are easy to slip on, or slippers with grips on the soles so that you can walk the hallways after surgery. If you don't have these things, that's okay. We will provide you with socks that have grips on the bottom to walk in the hallways. You should also bring a change of clothes for discharge, and you should have your lung transplant education binder with you as well. This is the binder that was provided to you by your transplant coordinator at the beginning of your evaluation. It will be used for discharge teaching. You should bring your cell phone and chargers, and you should also bring your medications and oxygen. You do not need to bring hygiene materials. These things will be provided for you as part of your hospital stay. You should bring a bag for your support person. They will need hygiene materials, comfortable clothing, and their cell phone and chargers. You should leave your valuable items, such as a wallet, wedding band, other jewelry, or a watch, at home. We would not want you to lose them while you're here, and you will not need them. You cannot take these items into surgery with you. It is very important that you bring enough oxygen for a round trip in case your transplant is canceled. A canceled transplant is called a dry run. We call it a dry run because although you did not receive lungs, it acted as a practice for the time that you do come in for transplant and receive new lungs. We will talk about reasons that a transplant may be canceled later on. When you match with the donor and are at the top of the transplant list, the surgeon will review the donor's lungs and the donor's medical history and see if the lungs are a good fit for you. If they are a good fit, the surgeon will instruct the transplant coordinator to call you to the hospital for transplant. The coordinator has 1 hour to contact you and cannot leave any voicemails or messages. This is a national policy. It's very important that you keep your phone on you and the ringer on at all times so that you do not miss out on your opportunity for transplant. We will use every minute of that hour to contact you. But if we cannot get a hold of you, the lungs will have to go to the next person on the list. Your coordinator may contact you from a number that you do not recognize. This is because the transplant coordinators use their cell phones when they are working from home at night, on weekends, and holidays to call patients in for transplant. You must answer every phone call while you are listed for transplant, even if it's a phone number that you don't recognize, because it may be your transplant coordinator. Scam callers are annoying, but we will identify ourselves as soon as you pick up the phone, and if it's not us, you can hang up. When you answer, the transplant coordinator will identify themselves, and they'll let you know that the surgeon has accepted lungs for you for transplant. They will ask you a set of questions to make sure that you are healthy. The questions will be, do you have an infection? Are you feeling sick? Are you on antibiotics? Or are you taking a high dose of steroids? It can be very dangerous, if not fatal, to transplant a patient with an ongoing active infection. So we need to make sure you are healthy. If you are healthy, you will be instructed to stop eating and drinking so that you can be prepared for your transplant surgery. Once the coordinator contacts you, you are not allowed to have any more food or drink from this time forward. Your coordinator will instruct you on what to do when you arrive to Michigan Medicine. You will be admitted to the Cardiovascular Center Intensive Care Unit, and your coordinator will tell you how to get there. You and your coordinator will set up a time for you to arrive to the hospital. If you have any delays in arriving to the hospital at your scheduled time, you should contact your transplant coordinator. Some delays might be getting stuck in a traffic jam, being pulled over, or getting in a car accident. If your delay is more than 10 minutes, you need to notify your transplant coordinator. When you arrive to Michigan Medicine's medical campus, you should follow the signs to the Cardiovascular Center entrance. When you arrive at the Cardiovascular Center entrance, have your driver drop you off and instruct them to park the car in parking structure P5. Parking structure P5 is located at the end of the driveway of the Cardiovascular Center. Once they've parked the car, have them meet you at the entrance. You can wait for your driver past the first set of double doors at the entrance of the Cardiovascular Center. Once you are in the first set of double doors with your driver or support person, you will see a second set of double doors. If it's during regular business hours, you can proceed through the unlocked doors. If it is after hours, the doors will be locked and you will need to use the phone that is on the wall. Contact security with the phone number listed there and give them your name and let them know you are here for your lung transplant surgery. They will be expecting you and they will unlock the second set of double doors. When you proceed through the second set of double doors, you will see a welcome desk. You can go past the welcome desk towards the elevators. There will be signs directing you to where the elevators are located. Take the elevator up to the 4th floor. When you arrive to the 4th floor, take a left out of the elevators. You will see a waiting area with many chairs and there will also be a desk. The desk will have a phone on it with a sign with a phone number. Use the phone to dial the phone number listed. The clerk for the intensive care unit will answer the phone. Give them your name and tell them you're here for your lung transplant surgery. And they will open the doors that are near the check-in desk there, and you will proceed through them to get to the ICU. The clerk will greet you, and then someone will show you to your hospital room. While you've been traveling to the hospital, your entire transplant team has been preparing for your arrival. If you have any troubles getting to where you need to be, all you need to do is to call the cell phone number that your transplant coordinator provided you, and you will be able to contact them with any questions you have about where to go or how to get there. Now let's hear about what to expect when you arrive to your hospital room.
Hi, I'm Courtney Clark, one of the nurse practitioners here at Michigan Medicine, and I'm welcoming you to our ICU. The clerk will be notified when you and your loved ones arrive, and they'll bring you back into a room into the CVC ICU. Once you arrive, we will get you in a gown, put you in the bed, get your weight, put you on the monitor. We'll start an intravenous catheter in your arm and draw some lab work. The lab work will let us know if your anticoagulation, if you're on a blood thinner, needs to be reversed, or what your type-in screen is to get your blood prepared for the OR. You will notice that processes will happen very fast. We call it a hurry, 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 and then we wait. Someone will come in from the team, introduce themselves, get your consent for the surgery. Someone will come in and start that IV. Someone will draw the blood. Someone might start a catheter in your wrist that tells us what your blood pressure is and also allows us to monitor your oxygenation and your ventilation. And at times, someone may actually put a larger catheter into your neck called a cordis and a Swan-Ganz catheter. We do try to do that in the OR most of the time, but there are times that require you to do it here at the bedside. You will notice that we all act very fast because sometimes we know your OR time and there are some times that we do not. We have to prepare for changes at any time and be very flexible. Things that could hold up an OR time is other hospitals are also trying to possibly place organs. We need to try to get all transplant centers OR time that fits for everyone. We have to match as many organs as possible, and we have to make sure that the surgeons are all available at all the right times. Another reason we all have to be flexible is the weather. A lot of times we have to fly out and get these organs, and we can never depend on what that will look like. Sometimes we drive, sometimes we fly, but everything has to be adaptable. Once we know of an OR time, we'll try to make sure you're able to update your family, and then if it changes, we're trying to keep you in the loop as much as possible. Sometimes it can be the next day. What we always try to say is be patient, trust the process, and everything is always for your best interest and the best interest of all the other organs. Finally, I would like to say that sometimes you come in and you don't leave here with the organ you came for. We do tend to call this a dry run. We brought you to the hospital to receive good lungs, and at any time during the process, those organs are deemed unacceptable for transplant, we may have to DC your lines and discharge you home. We don't ever plan on a dry run, but if it happens, we do try to look at it on a positive note. In the future, you'll know what it's like to come into the hospital and what the process looks like, and somebody picked up that the organs were not viable before they were transplanted inside you. So that being said, we will look forward to you coming back next time to get the lungs that are right for you. So we look forward to seeing you when you come to the ICU, and then we'll also be the people that you come out to right from the OR, and we'll help you get through your recovery. Thanks.
As Courtney said, there may be a long wait between the time that you arrive to the hospital and your surgery begins. This is normal. When it is time for your surgery, you will be escorted to the operating room, also called the OR, in your hospital bed by the OR and ICU nurses and techs. You will meet your surgeon in the operating room. A lung transplant surgery often takes up to 8 to 10 hours and can be much longer. Your support persons may not hear from your surgeon for many hours while you are in your transplant surgery. This is normal, and it just means that they are working. Do not hesitate to contact your transplant coordinator if you have any questions about what to expect when you are called for transplant and when you arrive to the hospital.